In today's video, I'm going to go over the #1 hidden cause of knee pain. Hi, I'm Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One of the most common conditions I treat in the office is knee pain. And often knee pain is caused by knee arthritis. Over time, it can cause osteoarthritis, which can generate pain and discomfort in the knee. But even though you may have knee arthritis, there's several things you can do to help prevent knee pain and help to relieve it. The #1 hidden cause of knee pain is muscle tightness in the quadriceps. So the quadriceps, there's 4 muscles that attach in and around the knee, and they flex your knee and they flex your hip. So what will happen a lot of times is because we sit all day long, our quadricep muscles will become really tight. That puts excessive stress on our knee. So if you are suffering from arthritis, that places much more load on your knee and can cause irritation. Because there's several people that have knee arthritis that don't have pain. So if we can reduce the strain and stress on our knees by working the quadricep muscles, we can help reduce knee pain and help prevent it. So what I'm going to do is I'm going to show you 2 simple ways that you can reduce knee pain at home. The #1 hidden cause of knee pain is going to be quadricep tightness. When we have tension and tightness in the quadricep, that puts more pressure on that already arthritic knee. So if we can loosen up these muscles in the quadricep, that's going to take a lot of pressure off the knee and help to reduce the irritation to the arthritic area. So what I want you to do, I want you to use either a massage gun or a foam roller, and we're going to work the 4 different parts of the quadricep. And by doing so, that's going to take a lot of the pressure off of the knee. There are lots of people that have knee arthritis, but they don't have pain. And again, if we can eliminate a lot of that muscle tension and tightness in the quadricep, that's going to take a lot of the stress and tension off of the knee itself. So we're going to turn on the massage gun. The first one I want to work is the main portion of the quadricep right down the middle of the leg here. So this muscle attaches in the hip and then also crosses over the knee. And so it's a very important muscle we want to treat. So we're going to start right in the middle portion of the thigh and then go up to the pelvis right through here. We're just going to go back and forth, and I want you to use a light to moderate amount of pressure. We shouldn't feel a really uncomfortable ache where you can't even take the massage gun up and down. And when you're first starting off, you may have to go really light with this one. And then you're going to go up and down, and I want to go down to about 2 to 3 inches above the kneecap, okay? So the muscle stops right about here and then it turns into tendon. So work down to about there. We don't want to be on the kneecap because that's going to be uncomfortable. And so we want to work right above that and find any of those tender spots and go back 10 to 15 times right on that spot and then move on to the next one. Okay, the next part of the quadricep I want you to treat is going to be the vastus lateralis, which is this big portion of the quadricep. So what we're going to do is we're going to find the IT band, which is this part here, and that first part here, and what we're going to treat is that portion in between. So often on a lot of people, this is going to be very tender. So again, light to moderate pressure. You find those spots, move back and forth. A common spot for a trigger point is about 4 inches up from the kneecap, and you're going to work this spot and you'll feel a lot of achiness right in this area. And then go back and forth, up and down. Now while you're here, I want you to go a little bit more lateral, and I want you to treat the IT band, which is here. So the last muscle, the vastus lateralis we just worked, actually extends underneath the IT band. And so a lot of times if you can work that IT band, get that deeper portion of the vastus lateralis and help relieve that knee pain. And again, this is going to be pretty uncomfortable for some people, so go light to moderate amount of pressure and this will help. Now if you deal with a lot of knee pain on the inside, the next muscle you want to work is this teardrop muscle here in the quadricep. So right above the quad on the inside, this portion here is often the source of a lot of knee pain on the inside. So we want to find that little teardrop muscle here and go back and forth. And again, I'm not on the kneecap here, we're just right above it. And we're going to work that spot up and down and treat any area for about 10 to 15 seconds and then move on to the next one. Then while you're here, I want you to work just up a little bit higher to that in the muscle which is called the adductor. So this also attaches on the side of the knee and it's right above that portion of the quadricep. So I'm going to work that inside portion of the quadricep right through here. And what it's going to look like to make it easier for you is, again, right around the seam of her pants, we're going to go right up and down, and you're going to find some tender spots right in through here. And this can help eliminate a lot of the knee pain as well. The final portion of the quadricep I want you to treat is deep to that first one we treated. Well, if you can imagine, there's another deeper layer to that first muscle we treated. Now, that's why I also want you to treat the other one first. So once we kind of loosen up that top layer, then we can go deeper. And so this may not happen on your first or second time you're doing this, but as you work it and loosen it up, you'll be able to press deeper. So we're gonna press deeper into that muscle to your tolerance. Again, you want maybe a moderate amount of achiness, but this will really help any kind of deep knee pain. Also, this can help if you also deal with any kind of hip pain as well. And just focus on those areas and then move on to the next section. What I would recommend is you do about 5 minutes each day for the first week or two, and then you'll start to reduce it down and do it 2 to 3 times a week, and then eventually once a week, and then as needed after that. But if you're dealing with any kind of chronic knee pain, this can greatly reduce a lot of that stress and strain on the knee and reduce your pain. So if you're suffering from knee pain, give my office a call at 703-912-7822, or you can schedule online at novacarwellness.com.